Welcome to the Invisible Wheelchair Podcast. The Invisible Wheelchair Podcast was selected by FeedSpot as one of the top 10 Obsessive Compulsive Disorder podcasts. I'm Donald Grodoff, EFT tapping practitioner and OCD coach at FamilyOCD.com. On the Invisible Wheelchair Podcast, I focus on the hidden world of OCD and anxiety with interviews and information around this topic. My purpose is to bring about awareness of OCD, those who treat OCD, and of course, those who suffer with OCD. Obsessive Compulsive Disorder is a treatable and manageable disorder. In my practice at FamilyOCD.com, I guide people through the process of ERP therapy and other alternative treatments. If you know of someone suffering with OCD, simply visit FamilyOCD.com. If you or someone you know suffers or has suffered and recovered from OCD and would like to get their story out, simply contact us through www.invisiblewheelchair.com. We want to talk to you and get your story out on the podcast. Know that the ideas and thoughts presented here are not necessarily those of Family OCD, Invisible Wheelchair Podcast, or Donald Grodoff. We also ask you to take just a few moments and leave comments at www.invisiblewheelchair.com. Those comments help us to know what the next topic should be, and we really want to hear from you. Now, let's get to that podcast. This podcast was recorded February 26, 2021. This is podcast number 54, OCD and Romantic Partners. And in this podcast, I want to talk about an article that I read that I thought was really good, and it gave some good pointers, something that I wanted to look into more with on the podcast series. And let me read the title of the article, and I'm going to give credit to who credit is due with who wrote the article and where you can find it. The article is called How to Support a Romantic Partner Who Has OCD, and it is by Sophia Melissa Caraballo Pinheiro, and it's done on the Cosmopolitan.com website. And it was actually done just 2 days ago, February 24th, 2021. So I want to just recap it. You can go to the article. You can search the article. I've got it up on, I put it up on my Family OCD Facebook page, and I think also on Focus Healthy Family page and the Invisible Wheelchair page. I'll put it up there, make sure it's up there, so you can look at the whole article. But I wanted to kind of brief it, and then she gives seven points to think about. So I wanted to go over that too. So again, this is just giving credit to who credit is due for writing an article, but I thought it was such a good article I wanted to broadcast it, get it out there, because it's good information. Because she's talking about in the article is how to deal with a spouse or someone you're dating or you're in love with, romantically, all of that, and how to deal with them with OCD to be able to still have a relationship. I, some time ago, interviewed a couple, I believe it's still on there anyway, that we talked a little bit about this and how difficult it was, but I kind of want to get that back and try to get another couple to talk about it. So if you are a couple that are dealing with one of you is OCD and you've had to figure that out, please let me know, because I would love to put you up here and put you on here to tell your story and talk about what to do and how to work through that when your partner has OCD. Or maybe you both have OCD. I don't know how that would work. That would be a tough one. But so anyway, you can look up that article, but let me just kind of talk about what she does in the article. Well, first, she talks about understanding that your partner does have it, and on top of that, she talks about having good communication with that partner. So by understanding what's going on, that they're going to have habits, patterns, quirks, you might want to call it, that are really basically called compulsions they're doing based on these thoughts that are rampaging through their head. And another thing, and I don't remember if she talks about this, but I think it's important for that partner to understand too that this is a real thing. This is something that is going on in the brain, that's physically going on in the brain, that's causing this. That this is not just some off the wall kind of thing they're doing, if it's true OCD anyway. So understand they're going to have quirks and patterns and compulsions they're going to do, and that this is going on in the brain, that there's a dysfunction of the brain that's causing this. So having good communications and talking about these things so that you can understand what the patterns are, what the thoughts are, so that you can at least have that understanding. And then, like I said, later on, it talks about educating yourself, all about OCD. Not to go by the myths that are out there about it, because it's not a cleanliness, it's not an organizational thing. It is an anxiety thing. And then working with them and blending into how they're doing their program, whatever their recovery or therapist program is, understanding that too, to see if you can be supportive and help in that program. So understanding the ERP, the exposure response prevention program that they really need to be doing, because that's the gold standard for therapy for OCD. They might want to look at ACT, acceptance commitment therapy. But whatever therapy they're in, is understand that therapy also. Work with their therapist to understand if you're that part in a committed relationship where it's not just a simple dating thing, it's a more serious thing. You may want to be part of helping them out in their program that they're doing, their recovery program they're doing. Be supportive. Now, in understanding being supportive means to understand that does not mean giving up your life. That does not mean giving up your things you do. Because what you don't want to do as a partner is to compensate or to feed OCD by doing the compulsions for them, or making sure all the things in their environment are done to handle those compulsions. You don't want to give up your life. You don't want to necessarily do things that you wouldn't normally do because of OCD, because you don't want to feed OCD. If you start doing the compulsions or these habits or patterns and things, or helping them do their patterns and habits and things, you could be feeding OCD. So you want to really check in with the therapist and get them to kind of show you how to best be the partner that helps and supports in a way that helps the person themselves, that doesn't feed the OCD but works to recover from it. So educate yourself. And what that would mean too is being what I call and work with people on is a compassionate coach, meaning you're their cheerleader. You're not their negative military drill sergeant that, come on, you got to do it. You got to do it. You're going to be damned if you don't. You got to, no, it has to be a matter of, hey, I know you can do this. I'm right here. I know you've got, it's tough to do. You can do it. And there's a lot to that. I've actually written a whole compassionate coach manual that I work with people on so they can kind of get a feel of what their role should be. If they are not getting help, but you really see that these OCD things are really happening, they've got to, do these things that you've probably heard about, but checking the doorknob, making sure it's locked 25 times before they can do anything. Repeating stuff constantly in their head over and over and over again. Counting and making sure that they have to do something a certain amount of times. Or really catastrophizing and taking off on that catastrophizing for hours. If you see those kind of signs, and you can look back on archives. I've done symptoms, archives on symptoms, and so that you can know what to look for in OCD. So that if they're doing that and they're not getting help, you might find a way to recommend it somehow, some way. And that's going to be your judgment as far as deciding how best to do that, because sometimes they won't take that kind of advice, or they might get mad at taking that advice. So you have to find a way to approach it that they could handle. So what I wanted to do too, things that you can do to support someone was, and this, she quotes it from a doctor, Magdalena Cadet is who she quotes this from. These are 7 points that this Dr. Cadet recommends. So I'm just going to kind of read them off and talk about them. So number 1 is be patient and don't dismiss or minimize their pain. So again, it goes back to understanding what is going on for them. That in their mind there is a dysfunction that goes on. That this is not something that they're faking or making up, or that there is a real looping factor that's going on in the brain, that there's a dysfunction in the brain. And to know that that is high anxiety that drives them crazy, that really works at them, that can make them depressed, that can make all kinds of things. Be there for a person that can just listen and empathize and not really try to fix that. Be supportive in the fix of it, but be supportive in the fix with their therapist, with their program. Number 2, understand their obsessive thoughts, their triggers and anxieties that make up their particular OCD episodes. So understanding that there's everybody's different in what they perceive as their OCD. What's their obsession? What's their compulsions? They vary so highly. And as a partner, part of that education, part of that understanding is knowing that it's not logical to you. To them, it feels very real, very logical what they do. But some of the compulsions they're going to do are going to be really strange, and it's going to seem so odd that they would do these things. So just keep that in mind, and don't try to fix that. Don't try to tell them that's stupid, that doesn't make sense doing that. Just say, wow, that's really tough that you're doing that. It really must feel a lot of anxiety with that. Number 3, practice self-care and keep strong, healthy boundaries in place so that OCD doesn't dominate your lives entirely. So what that means, again, and this is kind of goes back to that idea of when you're on a plane and as a parent, they tell you to put the gas mask or on yourself first and then on your children, because you have to stay healthy and alive to take care of them. So, and what this means is, yes, make sure you're keeping good control of your health by exercising, eating right, and all of that stuff. But also remember to keep healthy in the fact of not giving up your life to compensate for what they have to have because of OCD. So in other words, not giving into the things the reassurances. Understand, again, part of the education is understanding that a person with OCD will bombard you trying to get reassurance that the things that they're doing are good. The fact that they have to check and check and check and check something. They will ask you, right? I needed to check that, right? You don't need to bow into that. You don't need to give up what you're doing to fulfill that reassurance. Yeah, if that makes sense. I hope that does, because that's very important, because it's so easy to, I'll give you the example with my own child, is the fact that, we would do some of the things to compensate For her, she couldn't touch stuff, so we'd have to give her a box of forks in the box that she could reach in and get a new fork, eat it, eat with it, and throw it away. That was compensating because she should have been able to use regular forks over and over again, all of that. But we compensated for it, which was not good because what it does then in that example is it says to OCD, well, see, you're right. It's dirty to use another spoon or fork or whatever, and it's going to be bad for you if you do. So you had, see, you're right. They showed you had to do it that way. So it just feeds OCD. All right, number 4. Try to destigmatize OCD with your partner or family member. So I think part of that is knowing that, and we struggled with this trying to, whether we really labeled it with our daughter, and but I think it's important to let them know that this is not unusual as far as OCD. A lot of people have it. It's, it is an illness. It is a mental illness. It has a lot of anxiety to it. So you want to kind of make them feel that, I'm not alone in this. This is not something that just I have, as far as a person with OCD. Number 5, allow your partner to perform the compulsive behaviors and rituals even if there is a feeling of shame and discomfort. And what that's, again, I go back to the fact of checking in with the therapist on how they're working through the program or how that program is working. When I help somebody, I set up a program for them, and how they step through it. And so what that's kind of saying is that they probably still will be doing some compulsions. And if that's part of the program for their recovery, then you let them do the compulsions. And I'll give you again another example of that is when we finally got to a point with really doing the ERP and doing it effectively, we had so many compulsions that we had to pick the bigger ones first. So what we told my daughter was, as long as you're working on it, you're doing the work on it, the exposures as they call them, and doing that, working on some of the bigger compulsions, we will work with you on and help you through the other compulsions. In other words, we didn't make her give up all the compulsions. We had her emphasize on the strongest ones and work through each one or two at a time. And in the meantime, because she had compulsions of washing her hands, of not touching things, there was a lot of compulsions. We couldn't, knock them all out. But as long as she was making the effort, she was working on it and chewing through those compulsions with the exposures, we allowed her to do other compulsions, and we even supported them until she started working on those. I'm not sure if that makes sense, but you can't just wipe them all out and say you're going to work them all at the same time. You're going to work one compulsion, do the exposures with the ERP, and again, talking to the therapist about that is important. Number 6, be aware of your partner's treatment if they are willing to share it with you. So again, this goes back, and we kind of talked about this. Getting involved with it if they want you to, if they will allow you to, being their compassionate coach, as we talked about, but really involving yourself with the therapist to get to know, what do I need to do? What can I do? And then of course, and this is where the communication comes in, but talking with the OCD person, the partner, and saying, how can I be of assistance to you in this program? Can I be your compassionate coach? Can I be the one to support you, to back you, to be your cheerleader, that compassionate coach? And, and then there you can be firm, but you don't have to be military or obnoxious or mean. by firm is saying, hey, I know you can do this. Come on, you can do this. Let's do this. Let's do this one, because it gets tough. It's very difficult. ERP is not an easy program to go through. It is the best program to go through, I believe. And you can tie other things, like what I do in the ERP is I tie my tapping process, my EFT, into it. I talk about acceptance, even though I'm not an ACT therapist. I talk about acceptance and working. It's accepting the thoughts and dealing with the thoughts and managing the thoughts and all of that. So it's very important. It's I think very important for a person to have that compassionate coach as a cheerleader for them, as a person that'll help support them through this. Number 7, love them and make sure your partner knows you are there for them. And that's an interesting one, especially because what I like to say about that is something. This is going to might sound a little weird, but love is very important in this. And if this is, and that's what I think talking about, the type of relationship it is. If it's just a simple dating where it isn't necessarily there's a lot that the love is the bond there yet, that you're just doing some simple dating, trying to figure it out. But this is really for the person that might still be dating, that hasn't gotten married, or they are married, but there's a love bond there, and you're going to be in this relationship together. And so where love plays into it, I think, is what I did. Again, I bring up my daughter, and I tell this to all my patients and clients that I work with. OCD, well, let me back up. I use, if you know the story of Harry Potter. Now, we went through all of those books, movies, and all that stuff with all of our 3 kids, including the OCD kids that I have. And again, this might be a little spoiler, so if you haven't seen Harry Potter and you still want to, then stop this recording right now and jump ahead or something. But I'm using Harry Potter for this fact. I think the theme of Harry Potter, what really stood out for me in the end, was that Harry Potter, the reason that he was able to defeat Voldemort, Voldemort was the enemy here, was the fact that Harry Potter had the love of his mother instilled in him, and he too had that love. And Voldemort didn't have that love. So the reason I say that is because what I used to tell my daughter was, when we were going through this, was 10, 11, 12, that age, I would tell her, what's going to be the power you have over OCD is love. And you have other powers over them, but this is the strongest one that OCD does not have. And you want to use that love to push through it, to knock OCD down. So think about this fact that love is a very powerful tool in this. And that sounds very cliche-ish. It sounds very out there, I guess. But it's very true. So use that love from the heart to be that compassionate coach, to be the compassionate partner to that OCD person. Because and what kind of drove this in for me was, when I first fell into this with my daughter, my first daughter who has it. I have 2 daughters that have OCD. My first one, the first time we ever experienced OCD, I got very obnoxious with it. I always say I got kind of military with it, that I'm not a military person and I don't want to offend anybody in military. But I got very, fighting back at it, that's crazy, you can't do that, we're not doing that, no way, no, hell no, all of that kind of stuff. And that did not work. And what really kind of snapped me out of it were 2 things. One is my wife, who told me that to remember that within that beast of OCD that was coming at me, storming at me, screaming at me, yelling at me, trying to hit me, or whatever it was doing, it was pretty vicious. Inside of there is our daughter. The daughter that you love, that you cherish every moment with. And she was a wonderful daughter, still is. still is. And that kind of snapped me into the thought of, okay, I gotta separate those two. I gotta separate out the OCD from my daughter and remember always that within there. So to try to have compassion in there, to be able to reach through to her. And I think there were many times I was able to reach through to her because I was coming from love, because I was coming from a passion for loving my little daughter there, who was just the pride and joy of life. The second thing is when I finally was able to keep myself at a calm level when she approached me, even at the roughest stuff, if I was able to keep a calm level, her side didn't go up as high and usually disintegrated pretty quickly. So I really learned that being compassionate, being calm in my own place, staying in and not taking it personally, not being hit from the personal side of it, I was able to then manage it better and bring down that other side of her. So that love piece means a lot in this. So please keep that in mind as the compassionate coach, as a partner of the OCD person, that is important. So I hope that helps in deciding whether you want to be in that place, whether you can be in that supportive place, because it is tough. I will not fool you there. It is a tough place to be the supporter there, because it's going to come at you. But I promise you, you stick with it, help them through it, and they're going to be stronger on the other side for it. I say that about my daughter. She's stronger on this side because now nothing for her, I shouldn't say nothing, but most things that come at her that are tough, she goes, compared to what OCD is, that's nothing, And I use that a little generally, but I think that has a lot of truth to it. So good luck to you. Know that I'm here for you. I do coaching too and helping people through their OCD, and I'd be happy to work with you, help you to develop a plan along with your therapist on how you can get through this, how you can make it through this, how you can use the EFT that I use to get through it. So good luck again, and I wish you the best on it. Take care. This concludes this podcast. We really would appreciate your comments. Simply leave a comment at www.invisiblewheelchair.com. There, you're able to submit a comment that will help us determine future podcasts. If you or someone you know would like to be a guest on the podcast, please email Don at invisiblewheelchair.com. Remember, there is a corresponding tapping recording for each of the podcasts, with the exception of the interview podcast. You can find these tapping recordings and archive past podcasts at www.invisiblewheelchair.com. Finally, there is relief for OCD, and we at FamilyOCD.com and FocusedHealthyFamily.com can help you find that relief. Again, you can contact us through those sites, FamilyOCD.com or FocusedHealthyFamily.com. You can also find us on Facebook at Invisible Wheelchair Podcast. You can find us on Twitter at InvisibleWheel1, that's the number 1, or at FamilyOCD. So thank you for listening. Keep tapping and transcending your life to new heights.